Question: A 35-year-old female presents with a several-week history of progressive fatigue, weakness, and weight gain. She reports cold intolerance, constipation, and dry skin. Physical examination reveals bradycardia, delayed relaxation of deep tendon reflexes, and a puffy face. Laboratory tests show elevated thyroid-stimulating hormone, TSH, and low free thyroxine, FT4, levels. What is the most likely diagnosis? A. Graves' disease. B. Thyroid storm. C. Hashimoto's thyroiditis. D. Plummer-Vinson syndrome. Correct answer is C. Hashimoto's thyroiditis. This patient's clinical presentation and laboratory findings are indicative of Hashimoto's thyroiditis, an autoimmune thyroid disorder. Here's the rationale for choosing this diagnosis. Clinical presentation: the patient presents with several key clinical features consistent with hypothyroidism. Progressive fatigue and weakness. Weight gain. Cold intolerance. Constipation. Dry skin. Bradycardia, slow heart rate. Delayed relaxation of deep tendon reflexes. Puffy face. Laboratory findings: the patient has elevated thyroid-stimulating hormone, TSH, levels. In Hashimoto's thyroiditis, the immune system mistakenly attacks the thyroid gland, leading to thyroid dysfunction. Elevated TSH is the body's way of trying to stimulate the thyroid to produce more thyroid hormones. Additionally, the patient has low free thyroxine, FT4, levels, indicating a deficiency of thyroid hormone. Now, let's consider the other options. Graves' disease. Option A. Graves' disease is an autoimmune thyroid disorder as well, but it typically presents with hyperthyroidism, excessive thyroid hormone production, leading to symptoms such as anxiety, weight loss, rapid heart rate, and bulging eyes, ophthalmopathy. This patient's symptoms and laboratory findings are more consistent with hypothyroidism. Thyroid storm. Option B. Thyroid storm is a life-threatening complication of hyperthyroidism, usually seen in conditions like Graves' disease, and presents with severe symptoms like high fever, extreme agitation, confusion, and a very rapid heart rate. The patient in this scenario does not exhibit the typical signs of thyroid storm. Plummer-Vinson syndrome. Option D. Plummer-Vinson syndrome is characterized by the triad of dysphagia, difficulty swallowing, iron deficiency anemia, and esophageal webs. It is not related to thyroid dysfunction and does not explain the thyroid-related symptoms and laboratory findings in this case. In summary, given the patient's hypothyroid symptoms, bradycardia, elevated TSH, and low FT4 levels, Hashimoto's thyroiditis is the most likely diagnosis. This autoimmune condition leads to chronic inflammation of the thyroid gland, ultimately resulting in reduced thyroid hormone production and the symptoms of hypothyroidism.